Thank you for choosing Orthopedic Medical Group of Tampa Bay for your total joint replacement surgery. This video will walk you through what to expect before, during, and after surgery, and explain important steps to ensure a smooth, safe, and successful experience. Total hip and knee replacement surgery involves removing the damaged arthritic joint and replacing it with implants made of medical-grade metal and plastic. These implants are designed to reduce pain and restore movement. This is an outpatient procedure, meaning you will go home the same day. Most surgeries take place at Surgery Center in Lithia, Florida. Here, your surgeon has full control over your care and staff to deliver personalized care.
All surgeries carry risks. These include infection, bleeding, blood clots, nerve or blood vessel injury, and delayed wound healing. For knee replacement, numbness on the outside of the knee is common. For hip replacement, there's a small chance of dislocation or slight leg length differences. Patients with uncontrolled diabetes, smoking, alcohol use, chronic narcotic use, or obesity have higher risks. We will ask you to work on these areas before surgery to help ensure safety and good outcomes.
After surgery, you will walk with our therapy team within a few hours of the procedure. You should plan to have someone drive you home and stay with you on the first day. You may shower the next day with a waterproof dressing. Many patients find it helpful to have support in the days that follow, but it is not required. We encourage you to take an active role in your recovery. For the first 2 weeks, pain, swelling, bruising, stiffness, and sleep disruption should be expected. You will be provided medication to help with these symptoms, but it will not take away all of your pain. You should use a walker until your therapy team feels you can safely transition. Driving is only safe once you're comfortable, off narcotics, and are no longer using the walker. Return to work or sports varies on the person. Patients with seated jobs usually return within 1 to 3 weeks. Most patients return to more active jobs and sports at about the 6 to 8 week mark. Full recovery can take 6 to 12 months, and it is normal to have good and bad days during that time.
For best results, we recommend Orthopedic Medical Group Physical Therapy. Our therapists know your surgeon's protocols and communicate directly with your care team. This coordination helps you recover safely and efficiently. We can help schedule therapy at an OMG location near you.
At your office visit, you will receive a blue folder. This contains your testing orders and important surgery information. Please keep all surgery-related documents in this folder. Your surgical coordinator will schedule required appointments, including your joint class, preoperative visit, and post-operative follow-ups. These appointments are mandatory. Missing them may result in cancellation. Your pre-surgical testing includes lab work, an EKG, and sometimes medical clearance from your primary care doctor or specialist. All testing is due 2 weeks before surgery, but testing is valid for several months. That means you should start scheduling these appointments right away. Testing often takes weeks to complete. Please keep paper copies, as many offices do not send results, even when you request it. You may drop testing off at any OMG office or email it to jointreplacement@omgtb.com. If testing is not received on time, your surgery date will be postponed. Completing testing early may allow us to move your surgery date sooner if openings become available.
Insurance coverage varies. Most patients have 3 separate fees: surgeon, facility, and anesthesia. We start insurance authorization 4 weeks before surgery and communicate an estimated out-of-pocket costs with you. Failure to pay these fees will delay surgery. Some helpful items like ice machines or TENS units are not covered by insurance, but significantly improve recovery. These items are an extra cost and can be purchased at your preoperative visit.
Throughout this experience, you'll receive detailed educational materials to guide you through every step of the way. We encourage you to review these items as they answer most questions and help you feel confident and prepared. This allows you to take an active role in your care and keeps our team available for any additional support you may need. By completing your testing on time, attending appointments, and following your care plan, we can work together to achieve a safe surgery and excellent outcome.